Hello friends, welcome back to Complete Medical Coding. Today I am here with some important repeated ICD-10 questions. Okay, some repeated ICD-10 questions. We'll discuss it today. Okay friends, so let's move to the questions directly. What is the first question? See, this type of ICD questions, it could come under medical terminology session or in the ICD session also. Okay, not only codes, you will get some other terminology type questions as well. Anyway, moving to first question. Sequela describes a condition that is. So, what is the exact description for sequela? Option A combination of two or more diseases. Option B, late effect of a previous condition. Option C, manifestation of an underlying etiology. Or option D, not represented in ICD-10. So what does sequela means? As you already know, there is initial, subsequent and sequela, right? So if it is an initial injury, all these are related to injuries. So if it is initial encounter for a patient, like the initial visit of the patient to a provider, to a physician. Okay, that is initial encounter. Subsequent means the next step. It's not an initial encounter, it's a follow-up visit, but it's a subsequent visit. Like what you say, it is not cured from the first visit, so it's a subsequent visit, frequent visit. And sequela is a late effect. That is a last. Many times they are coming, or what you can say, the late effect of a previous condition. Some conditions, it could be an injury or some other condition, but it is still present in the patient and still present, plus there is some late effects of that previous condition. That is which is called as sequela. The extreme condition, that is called as sequela. So here the answer is option B. Okay, late effect of a previous condition, that is sequela means. Okay, so it's an easy one, but few might not be knowing. So that is the reason I came up with some important questions. Anyway, moving to second question. How will you code heart failure due to rheumatic heart disease? So it's directly given. It's a direct question. How will you code heart failure due to rheumatic heart disease? Okay, let's check all the codes one by one. So you can first take your ICD code book, go to first code I50.9. What is I50.9? Take your ICD code book and take I50.9, that is just heart failure unspecified, right? I50.9 is just mentioned heart failure unspecified. Okay. What is option B? I50.1. What is I50.1? Left ventricular failure unspecified. Left ventricular failure. What is option C? I09.81. I09.81. What is I09.81? Rheumatic heart failure. Okay. Yes, we need rheumatic heart failure. That is what due to rheumatic heart disease, the patient is having heart failure. Anyway, let's check the last code also. I50.20. What is I50.20? I50.20 is unspecified systolic heart failure or congestive heart failure. That is unspecified. But here in our question, it is mentioned as rheumatic. Because of the rheumatic heart disease, the patient got heart failure. So the correct answer will be option C, I09.81. Right? It's a combination code. So I09.81, which means rheumatic heart failure. That is the correct answer. Okay. Moving to the third question. This is an important one. Okay. And the most frequently asked question in CPC exam as well. So, what's the third question? how is the postpartum period described according to ICD-10 guidelines? Such type of questions you will be getting in exams as well as in interviews also. Okay. So how is the postpartum period described according to ICD-10 guidelines? What do you mean by postpartum? We are seeing every time in all the most of the maternity codes, it is mentioned that postpartum delivery, antepartum and postpartum delivery, all that is mentioned, right? So what exactly the description of postpartum period, or when is that postpartum period starts and ends? Okay, let's check all the options. What is the first option? It includes, here it means postpartum period. Okay, so postpartum period includes the last month of pregnancy and up to 5 months after delivery. Option B, postpartum period begins immediately after delivery and continues for 6 weeks following the delivery. Option C, postpartum period is different for each pregnancy. Option D, postpartum period begins immediately prior to delivery and continues for 6 weeks after the delivery. So what exactly is postpartum period? Of course, it is something related to delivery. So is it, as you know, all, it could be either option B or D, right? But don't be confused with options B and D. In D, it is mentioned postpartum period begins immediately prior to delivery, before delivery and continues to 6 weeks. No, that is wrong. It begins immediately after the delivery and then continues for 6 weeks following the delivery. So postpartum period is always from, so here the correct answer is option B. Okay. It begins immediately after the delivery. So postpartum period begins immediately after the delivery and it continues up to 6 weeks, or you can say 45 days following the delivery. From the delivery 45 days, or from the delivery 6 weeks. Okay. That is the exact description for postpartum period. Alright. Now fourth question. What is the guideline for surgical aftercare codes? What is the main, when you code for surgical aftercare codes, what is the main guideline or what you have to keep in mind when you code for surgical aftercare codes? Let's discuss that. Let's read out all the options. Option A, codes which are generally first listed and explain the reason for the encounter. Option B, only one aftercare code may be listed per claim. Option C, aftercare codes are conditions the patient has had in the past but no longer exist. Option D, aftercare codes do not exist in ICD-10 and the acute code should be listed with a 7th character describing the encounter. So what exactly is the guideline for coding a surgical aftercare code? Here the correct answer is option A. Okay, surgical aftercare codes. These codes are generally first listed codes and explain the reason for the encounter. Okay, it should be the first listed code and it should explain the reason for the visit, for that patient visit, reason for the encounter. So option A is the correct answer. Okay, rest everything is wrong. Now, fifth question. Patient admitted to home health for IV antibiotics. The documentation states the patient has septicemia related to an infected surgical wound. What should the coder do in such cases? That is what the question is. Okay, so here the patient has been admitted for IV antibiotics. Okay, for getting antibiotic injection through IV. The documentation states that the patient has septicemia. I had already taken the guidelines just 1 or 2 episodes before, the guidelines for coding sepsis, right? So in that I had mentioned each and every medical terminology, medical terms, septicemia, the organism that is causing sepsis. So the patient has septicemia related to an infected surgical wound. So this documentation or this patient is having septicemia, the organism which is related to some infected wound, surgical wound. So in such cases, what should the coder do? Okay, let's read out all the options. First option, option A, Code sepsis since septicemia is not a term in ICD-10. Option B, query the physician for clarification. Option C, ask the assessing clinician if septicemia should be coded. Option D, only code the infected surgical wound. So in such cases, what should a coder do? How will a coder code? Will the coder code the infected surgical wound only, or will they code sepsis only, or will they ask the physician for any clarification, or will they ask the physician saying only septicemia can be coded? What is the answer? Here the correct answer is option B. You should get a clear clarification from the physician. Okay, query the physician for clarification. You should get an exact clarification from the physician for such kind of documentation. If you have any inquiry, or if anything mismatches, or if there is anything, something which is not related to another one, you have to always ask. You have to always clarify it with the physician, treating physician. Okay, so here in such cases, query the physician for clarification. All right. So in some questions, most of the options seems to be correct, but there should be one exact. There will be one exact option which marks the exact answer. So that you have to mark it. You will get such type of tricky questions also in the examination. Okay. So anyway, friends, that's it for today. Some important ICD repeated. When I came across, many question papers, I saw some repeated questions, recent repeated questions. So that's why I thought of sharing it with you. So I think this video is going to be useful. If it is useful, please like and share it among your friends. And if you are new to the channel, please subscribe. Okay. Thank you so much. Bye. Take care. See you in the next episode with more questions, more and more practice questions. Okay. Thank you. Bye. Take care.